know that social media is often leveraged in healthcare among providers. And I think you mentioned, Dr. Chang, an app. So are there any other digital tools or are there ways that either of you leverage social media in order to manage side effects, either with education to providers or to patients? And Dr. Ehrman, I'll start with you on this one.
Sure. So social media is a tricky one because not everyone uses it. Also, in CLL particular, our median patient age is around 70 years of age, and not too many of my 70-year-old patients are on, but they can be. So I think as a provider, there's a couple things. I'll be honest, Twitter is actually can be a great resource. If you follow certain providers in the field, you'll get some updated information before anyone else, including especially during our annual ASH meeting. There's an ASH app, and if you attend the meeting, you'll see the most updated data, and you can see that on Twitter and or X as well. Other than that, we also have a Huntsman app similar to Emory. But I think that's about as far as social media goes for me. What about you, Dr. Chang?
I agree with Dr. Ehrman that places like X and LinkedIn, if you follow the right people, you can get very useful information. And I think that that's particularly true for people within the academic community and healthcare providers. But for patients per se, I think that this could be a little bit more tricky. And so I try to steer them away from that, in fact, and I try to kind of keep them in within the main resources. And if they have any questions or they're confused about something, I always tell them, feel free to send me a message, and we're happy to discuss whatever you read. And so I find that patients really appreciate the openness and the of discussing data, because sometimes the data might be not very accurate, and by having that trust, they find it comfortable talking about things that might not be as conventional as we might think so.